There are many kinds of prescription pain medications, but among the most powerful are a class of drugs called opioids, which include morphine and codeine. Opioids are typically prescribed to treat acute pain, usually for short periods of time. For example, if you've ever had surgery in the hospital, chances are you were given an opioid drug after the procedure to control pain during your recovery. Even if you've never been prescribed an opioid, you probably already know some of their names, and odds are you've read about them or seen news stories on TV. But even so, for most of us, what they are and how they work is mostly a mystery. For people with chronic pain, those are important things to know. So let's start at the beginning.
Well, an opioid is a synthetic or non-synthetic chemical that's derived from the opium poppy. And within the opium poppy is morphine, codeine, and some other chemicals. And then over time, pharmaceutical industry has developed cleaner versions of that basic morphine compound.
Opioids can be used to relieve acute or chronic pain. In acute pain, opioids may be very successful in reducing or eliminating the pain. Examples of these types of pain might be a toothache, or an ankle sprain, or a backache. But with chronic pain, the situation is a little more complex. Opioids used for chronic pain are used to reduce your pain level. Between you and your physician, you will decide what is an acceptable level of pain control. And opioids can be a very useful tool in reducing your pain to an acceptable level.
Some medications, such as the anti-inflammatories, treat the actual cause of pain, but opioids work differently by affecting the way we experience pain. Opioids target specific cells within the central nervous system that have the power to regulate the amount of pain we feel. Special molecules on the surface of these cells, called receptors, act as pain switches that turn on or off in the presence of certain chemicals. When opioids bind with the receptor molecules, the switch is turned off.
When an opioid binds to a receptor, think of it like a key that's put into a lock. What it does is it changes the way that you process pain. So it reduces the amount of pain that you have.
An opioid receptor can be compared to other receptors in the body. You know, our body is very complicated and it responds to different chemicals and it creates electrical signals. A receptor is just part of a very intricate cell. And that receptor, in the case of a medication, once it can be turned on or turned off.
Now, the opioid attaches to a receptor, and these receptors are in the central nervous system. What happens with pain transmission is that pain is transmitted through sort of an electrical network in the body. And the opioids attach to the receptor and block these transmissions of electrical stimulation that are carrying the pain impulse through the central nervous system.
Opioids are routinely prescribed and safely used to treat pain every day. But some people are apprehensive about using them, partly because they know that opioids are very powerful drugs that need to be used with caution, and partly because prescription opioids are often wrongly associated with illicit narcotics, like heroin. Opioids are, in fact, classed as narcotics, and their distribution and use is tightly regulated. It's true, too, that opioids can be abused and are sometimes bought and sold illegally. However, we need to understand that narcotic is a legal term, not a medical term, that covers many different types of drugs that are regulated because of their potential for abuse. Just because they're considered narcotics under the law doesn't mean that opioids are bad drugs or hard drugs. What they are is remarkable prescription medications that help millions of people control pain legally every day.
There's an important difference between an opioid and a narcotic. A narcotic is anything that's federally regulated. So me as a physician, I have a license to prescribe medications. My license is regulated. And so if I do something wrong, I can be charged with a narcotic violation. So narcotics include opioids, benzodiazepines, but they also include drugs of abuse, PCP, marijuana. And so the government has regulated all these, and they've categorized them in different areas. So narcotic is a kind of all-encompassing term versus an opioid is that medication, whether it's oral or a patch, that's used to affect the opioid receptors. So I think the opioid is a medication, and a narcotic is more of a kind of a federal term or a state term, a legal term.
Used with care, opioids can be a powerful tool to help you manage your pain. But it's also a mistake to think that they're a magical cure-all, a magic bullet for chronic pain. Opioids are very good at what they do, but they're not 100% effective all the time in every case. Opioids work differently with different people, and they're more effective on certain types of pain than others. In addition, opioids can lose effectiveness if you use them over long periods of time. And even when they work well, they require careful monitoring to make sure that the positive effects of the drug outweigh the side effects that come with them. When you strip away all the misconceptions, opioids are just another tool to help you manage pain and take greater control of your life.
Opioids are very effective pain relievers, but especially in chronic pain individuals, they may not relieve all of your pain.
Well, I think the goals of an opioid and why we would be using them would be similar to anything in pain medicine, which would be to hopefully decrease pain, improve function, improve quality of life, and limit the potential for, bad effects of the medication.
With chronic pain, many times you will not achieve full relief of pain, but you and your physician will decide what is the degree of pain relief that I am looking for and that I feel comfortable with. So first and foremost, the opioid will be used to produce pain relief. Secondly, the opioid should be able to allow the person to manage their pain and function appropriately in their everyday life.